passive range of motion of the hip, and we're performing flexion, and there's no pain, so we can do overpressure. Right here we can also assess for internal rotation and external rotation. I'm going to have the patient turn onto their stomach so we can assess hip extension. And again, it's passive, so I will perform the movement for him and stabilize the pelvis. And go ahead and turn onto your back again. Now we will be assessing, or we will be performing the Faber test. So we're going to bring the hip into 90 degrees of flexion, abduction, and external rotation. And we'll stabilize the opposite side of the pelvis. A positive sign would be reproduction of pain in the hip or in the SI region. To assess the Fader test, we're going to be in flexion, internal rotation, and adduction. And again, we're assessing for reproduction of pain in that hip or SI joint. And to assess the hip or to perform the hip scour test, we'll have the patient in flexion again, slight adduction and internal rotation, and we'll apply compression down into that hip joint. So that would be the beginning of the scour, and we're gonna arc that motion out more into abduction and external rotation. And then again apply that compression down into the hip joint. We're assessing for any pain, apprehension, or catching in the joint, and that would confirm a positive test. So we can assess the fulcrum, so we can perform the fulcrum test. This would assess if there were any fractures in the femur. I'm going to lift the patient's leg up onto my arm. Go ahead and relax it here. Sorry, I'm going to place my hand right here on your side. And I'm going to apply pressure to the distal part of his femur and assess for any, not instability, but any movement within the femur itself to see if there's any displacement or fractures. And we can even assess slightly more proximal. And a positive test would be pain, discomfort, or any displacement within that femur.